Medicare for Veterans, Medicare and VA benefits. Everything you need to know will be shown to you in this video. VA healthcare and other insurance. If you have other forms of health care coverage, like a private insurance plan, Medicare, Medicaid, or TRICARE, you can use VA healthcare benefits along with these plans. A lot of the veterans don't realize that you could combine both plans. And a lot of the plans from the private insurers have zero premium, and there are special programs just for veterans. Why does VA require you to provide information on your health insurance coverage, including coverage under a spouse's plan? VA will ask you for this information because the VA will have to bill your private insurance company provider for any care, supplies, or medicine VAs provide to you to treat your non-service connected conditions, illnesses, or injuries that are unrelated to your military service. The VA won't bill Medicare or Medicaid, but VA will bill Medicare supplement health insurance for covered services. What if your health insurance provider doesn't cover all the non-service connected care that the VA bills them for? You won't have to pay any unpaid balance not covered by your health insurance provider, but depending on your assigned priority group, you may have a copay or non-service connected care. Does it help you in any way to give VA your health insurance information? Yes, giving the VA your health insurance information helps you because, one, when your private health insurance provider pays the VA for non-service connected care, the VA may be able to use the funds to offset part or all of your VA copayment. Your private insurer may apply your VA healthcare charges toward your annual deductible, the amount of money you pay towards your care each year before your insurance starts paying for care. Does your current health insurance status affect whether you can get VA healthcare benefits? No. Whether or not you have health insurance coverage doesn't affect the VA healthcare benefits you can get. If you signed up for a VA healthcare program, does that mean you meet the requirements to have health care under the Affordable Care Act or the Obamacare? Yes, being signed up for a VA healthcare meets your Affordable Care Act health coverage requirement of having minimum essential health coverage. You don't need any other insurance to meet this requirement. Note, it's always a good idea to let your VA doctor know if you're receiving care outside VA. This helps your provider coordinate your care to help keep you safe and make sure you're getting care that's proven to work and meets your specific needs. In this slide, you can see that the Medicare card, along with your VA card, can work together to give you the best treatment. More about how VA healthcare works with Medicare and other insurance. Should you give up your private health insurance or other insurance like TRICARE or Medicare if you're accepted into the VA healthcare program? This is your decision. You can save money if you drop your private health insurance, but there are risks. The VA encourages you to keep your insurance because, one, VA doesn't normally provide care for veteran family members. So if you drop your private insurance plan, your family may not have health coverage. Two, VA doesn't know if Congress will provide enough funding in future years for it to care for all veterans who are signed up for VA health care. If you're one in the lower priority groups, you could lose your VA health care benefits in the future if you don't keep your private insurance. This would leave you without health coverage. If you have Part B coverage for doctors and outpatient services and you cancel it, you won't be able to get it back until January of the following year. You may also have to pay a penalty to get your coverage back, called reinstating your coverage. Now, VA benefits. People with Medicare and VA benefits can get treatment under either program, must choose which benefits to use each time. Generally, Medicare cannot pay for service authorized by VA, and VA cannot pay for service provided by Medicare. In limited situations, both can pay. Now Not everyone has full VA benefits. Under Medicare Advantage plan, you can get glasses, dental care, uh, hearing aids, items that you might not have qualified under your limited VA coverage. If you already have VA health care benefits, should you still sign up for Medicare when you turn 65? Yes, VA encourages you to sign up for Medicare as soon as you can. This is because VA doesn't know if Congress will provide enough funding in future years for it to provide care for all benefits who signed up for VA health care. If you're one of the lower priority groups, you could lose your VA health care benefits in the future. So be aware what group you belong to. Having Medicare means you're covered if you need to go to a non-VA hospital or doctor, so you have more options to choose from. If you delay signing up for Medicare Part B, coverage for doctors and outpatient services, and then you need to sign up later because you lose your VA health care benefits or need more choice in care options, you'll pay a penalty. This penalty gets bigger each year you delay signing up, and you'll pay it every year for the rest of your life. Ouch! If you sign up for Medicare Part D, coverage for prescription drugs, you'll be able to use it to get medicine from non-VA doctors and fill your prescriptions at your local pharmacy instead of through the VA mail order service. There's no penalty for delaying Medicare Part D. Now, what do Medicare Advantage Plan or Part C plans cover? Medicare Advantage Part C includes all the benefits of Part A, including hospital stays, skilled nursing home, health care, and associated services. Medicare Advantage Part C also includes all the benefits of B, including doctor visits, outpatient care, screening and lab tests, and associated services. Prescription drug coverage is included in many Medicare Advantage plans. Now, you can get a plan that does not have the prescription portion, and you get that from the VA. Additional benefits may be included, such as dental, eye care, hearing care, wellness services, and a nurse helpline. Medicare Advantage plans all have a yearly limit on your out-of-pocket costs for covered medical services. This limit may vary for different Medicare Advantage plans and can change each year. Now, what does that mean? In original Medicare, there's no limit of how much you would pay out of pocket. With an Advantage plan, it puts a cap on the most you can pay in any given year. If you signed up for VA health care and you also have Medicare, what's covered by each? You need to choose which benefits to use each time you receive care. To use VA benefits, you need to get care at a VA medical center or other VA location. VA will also cover your care if we pre-authorize you, meaning VA gives you permission ahead of time to get services in a non-VA hospital or other care setting. Keep in mind that you may need to pay a VA copayment for non-service connected care. If you go to a non-VA or VA authorized care facility, Medicare may pay for other services you may need during your stay. Or, if VA only authorizes some services in a non-VA location, then Medicare may pay for other services you may need during your stay. Check your Medicare plan so you know which care locations and services you're covered for. Can you use your health savings account or health and reimbursement arrangement to help pay for your care? Yes, the VA will bill and accept reimbursement for high deductible health plans for medical care and services used to treat your non-service connected conditions. If you have an HDHP linked to an HSA, sounds like the Army, you may use your HSA to pay your VA copayments for non-service connected care. VA may also accept reimbursements from HRA for care they provide to treat your non-service connected conditions. So health savings account benefits contribute tax-free money, help pay for qualified medical expenses, help pay for most medical care premiums, and grow retirement nest egg. Does VA need your permission to bill your other health insurance for care provided to a sensitive diagnosis like alcohol or drug abuse or HIV? No. As a result of the VA Mission Act of 2018, VA no longer needs permission to bill health insurance providers for care related to a sensitive diagnosis like alcohol or drug abuse, alcoholism, HIV or HIV testing, sickle cell anemia, or other diagnoses including the Public Law 38 U.S.C. 7332, protected information. Before submitting any claims for care related to a sensitive diagnosis, VA notifies veterans of their change by sending a one-time notice to all veterans who had signed a release of information refusing to allow us, the VA, to bill your care related to a sensitive diagnosis in the past. The Federal Register also published this change. VA is now submitting claims to health insurance carriers for all non-service collected care, even if VA doesn't have a signature or written authorization permitting VA to disclose protected information on these claims or in veterans' medical records. VA is required by law to bill your health insurance, including your spouse's insurance if you're covered under her policy. The money collected goes back to VA medical centers to support health care costs provided to all veterans. You can submit a restriction request asking VA not to disclose your health insurance information for billing purposes, but VA is not required to grant your request. To submit a restriction request, please contact your nearest VA healthcare facility and ask to talk to the privacy officer. You can also ask to talk to the billing office for more information. Now, it's never too late to start over. If you have a drug problem, alcohol problem, or any other problem, psychological or mental or health, get help today for a brighter tomorrow. For many years now, I have helped guide seniors and veterans like you through many options available to satisfy their health insurance needs using convenient, non-home invasive online meetings and presentations. Let me help you. My website is insuredmeds.com. My cell, you can text me and I'll get right back to you, 845-380-5809. I work for you, not the insurance companies. I'm licensed in New York, Florida, and North Carolina. I'm a 5-year service veteran. My toll-free number is 1-888-200-2040. Pretty easy to remember. 1-888-200-2040. Please share with your family and friends, and I'm here to be of service to all veterans. And again, thanks for your service.